I just try to tell people so much, like, you deserve to feel good in your body. You get one body and you get one pelvic floor. And there's a lot of other shit that's going to take us out in this world. But like, do what we can to care for the one that we have.
Welcome to Sleeping Around, where we offer a peek behind the curtain of modern sex and relationship therapy and research, bringing you insights and conversations otherwise reserved for the therapy room. I'm your host, Elena Joy, a Master's of Counseling Psychology student, content creator, and lifelong sex and relationship nerd. Enjoy the episode. Hello, everybody! Welcome back to another episode of Sleeping Around. My voice is finally recovering, almost fully. There's still cracks here and there, but it's back, baby. So we are back to the internet. Today's episode is practical. It's important. I learned so much about the pelvic floor and not only how to care for it, but how not to care for it. We cover a lot of common and not often talked about problems, not only pain during sex, but bladder control and orgasm quality. And I'm just really excited to share all of this information with all of you. Hi, Bugs. Our guest today is Dr. Sara Reardon. She is a board-certified pelvic floor physical therapist who has been caring for folks' pelvic floors since 2007. She's the founder of the V-Hive, which is an online pelvic floor workout platform for pregnancy, postpartum, menopause, painful sex, and all pelvic floor strengthening. She's also known as the Vagina Whisperer on Instagram and TikTok. And her book, Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage, will be available for pre-order this summer. Thank you for being here. Thank you for listening. I hope that you find this episode as informative and interesting as I did. I won't keep you any longer. Enjoy. Do you want to just start by telling us a bit about you and how you got into pelvic floor therapy?
Absolutely. So I am, by degree, a physical therapist. I have a doctorate in physical therapy. So I got my bachelor's degree and went on to physical therapy school thinking I was going to be a sports physical therapist for the New Orleans Saints back in my hometown. Well, I went a very different route, clearly. But during my graduate school education, one of my professors started teaching about women's health. And at that time, it was mainly focused on pregnancy and postpartum. But she was teaching us about our pelvic floor, which was a group of muscles I had never heard of. And it just really intrigued me that, oh, these are muscles that nobody talks about, yet they're really impactful. And I really enjoyed learning about my own body as a woman. And then once I started doing clinical rotations and did one in women's health, which we now call pelvic health, I loved the patients. I just thought it was really rewarding to be able to educate people about their bodies that they didn't even realize existed or that was contributing to a problem they were having, and to help improve their quality of life by helping them have more pleasurable intercourse or less leakage or recover from pregnancy and birth. So it's really a journey I started 17 years ago. I've been practicing ever since I graduated in 2007, which is going to date me. But I've been on this journey ever since. And in the past 3 to 5 years, I would say we've seen a real huge movement to just increase awareness and increase the conversations we're having about the pelvic floor and pelvic floor therapy.
Yeah, I feel like I only have heard even the term pelvic floor in the past few years with like some folks I follow online who've gone through pregnancy and birth. And then you hear people talk about like strengthen the pelvic floor, or so that you don't wet yourself after you give birth, you have kegels, all of that stuff. So it's really neat that this is kind of coming into the zeitgeist, and yet I feel like I know nothing. I don't actually know like what that really, the implications of that, what I should be doing to take care of it. So I'm excited to be chatting with you.
Well, I assure you, you're not alone. I think that yourself and many other people who follow along and are listening to this will feel the exact same way. I think it's a really mystical part of our body. And again, because it's part of our vulva, our vagina, there's also a little bit of shame and embarrassment that comes with talking about this part of our body. And that's really what I want to change. I think the fact that we're even able to have podcasts where we're talking about, pelvic floors and vulvas and vaginas. And, I'm able to show videos on my social media account about like how to pee and how to poop and proper ways to push during birth and great lube options. It's really educating people on something that shouldn't be so shameful and is really so common. I mean, I've been in this practice for 17 years and have worked with thousands of women who have had pelvic floor issues. And so you're not alone if you're experiencing them, but you're also not alone if you have no idea what this part of your body does and how to care for it.
So all of the kind of social media questions you just listed, how to go to the bathroom, proper lubes to use, all of that stuff. I'm like, okay, please tell us all of the answers. But first, can you start from the beginning and tell us, like, what is a pelvic floor physiotherapist?
Yeah. So I am a physical therapist, and physical therapists, or PTs as we call ourselves, specialize in treating muscles and nerves and tissues in our body. And you may have a shoulder specialist or a hip specialist, and I'm a pelvic floor specialist. And the pelvic floor muscles are a basket of muscles that sit at the bottom of our bony pelvis. So we're probably all used to seeing the skeleton on those Halloween pajamas or that, anatomy figure that you see in doctor's offices. Well, the pelvis is a bony ring, and at the base of that is a basket of muscles that attach front to back and side to side. So it just looks like a hammock that sits at the very bottom of those bones. And inside of that hammock, in a female body is your uterus, your ovaries, your rectum, which carries poop, your bladder, which holds urine. And so this basket of muscles supports all of those organs. And it also has the urinary sphincters and the anal sphincters that help keep urine and stool in. And it has the opening to the vagina. And that's in a female body. Male bodies also have a pelvic floor. They just have two openings, one for the urethra, and they have one for the anal opening. They don't have a vaginal opening. So all bodies have a pelvic floor. Obviously, as the vagina whisperer, folks with vaginas are my wheelhouse right now. And so when we see challenges come up in this arena, it could be peeing problems like leakage or difficulty emptying your bladder or pain with urination. It could be constipation, hemorrhoids, fissures. It could be painful intercourse, painful menstruation. So, even tailbone pain. So really anything between your ribs and your knees, your pelvic floor is likely involved. And we want to address those muscles if we're going to treat something in that area.
I feel like there are probably a lot of folks out there who are hearing something like constipation or pain with intercourse, and they're going, okay, I experience those things, but how do I know if it's not normal? Like, lots of people I know experience those issues. How do I know if I should go and see a specialist?
I think it's a great question. And I think it's important to know what is normal. So a big part of my platform is educating people about what is normal urination frequency. So it's normal to pee every 2 to 4 hours during the day and 0 to 2 times at night. You should be able to sit down, relax your stream without pushing. Don't push when you pee. Your bladder's a muscle that pushes the urine out for you. So you should just be sitting and chilling and breathing, and the urine comes out.
Don't push when you pee.
Don't push when you pee. You just sit and chill and breathe, and your bladder does the work for you. And then you should be able to wipe and walk away. So that's normal urination, and no amount of leakage is normal. It's common. So we see it often with female athletes who have never had babies. We see it during pregnancy, postpartum, with aging, during perimenopause and menopause. So it's common, but it's not normal. And just leakage itself is an indicator of a pelvic floor issue, unless there's an infection, like a urinary tract infection or a bacterial infection that you want to rule out. The same thing with bowel movements. What's normal for a bowel movement is to have a bowel movement 3 times a day to 3 times a week. So you don't necessarily have to go every day, but you should be able to poop without straining. You should feel like you empty completely. There shouldn't be excessive wiping, no hemorrhoids, fissures, or pain with bowel movements. If your poops are coming out really thin or hard, or if you have difficulty keeping poops in and you have some leakage or smearing in your underwear, also signs that those muscles are not working optimally. So those are other signs. If you have to rely on stool softeners or laxatives or enemas, another sign that you have constipation and your pelvic floor muscles are likely involved. And then lastly, when it comes to sex, I'm talking about typically vaginal intercourse. You can have anal intercourse. There's types of sex that don't involve something inserting into the vagina. But any type of pain in our body is information. And if you're having pain with sex, that's an indication that something's not functioning properly. You may have pain with initial insertion and it feels like something's either tearing, ripping, or hitting a wall. You may have pain with deeper insertion. It feels like something's bruisey or tender or getting hit. Certain positions may be more uncomfortable than others, or you may have pain afterwards. So all of those are indicators that something's not working optimally. Also with sexual activity, you may have difficulty having orgasms. You may have leakage during orgasms. You may have weak orgasms. All of those are other indicators that there could be a pelvic floor muscle component. Your pelvic floor muscles are the ones that need to relax for you to have sex, for you to empty your bladder and bowels, and they're the ones that contract to hold in urine and stool and contract and relax during orgasms. So anything in those arenas that's problematic for you, it's valuable to at least get your pelvic floor muscles checked out. And the therapist will tell you, yep, there's an issue, or nope, things are working great. Let's refer you on to another specialist.
I love the phrase and then like reiteration of common but not normal, because a comment that I see a lot online in my comment section when I asked my audience what kind of questions they had for you is around pain during intercourse, right? And I feel like this is one of those things that kind of in the zeitgeist is almost considered normal, acceptable, expected, like not that big of a deal in terms of folks who have vulvas and are having penetrative sex. It's not something that people talk about. It's maybe not something that people know that isn't normal, like, and can be treated, can be helped. Can you talk a little bit about some of the causes potentially of pain during intercourse, and then what can somebody do?
I think it's interesting because I do think that pain is something we kind of have these, mantras that people say like no pain, no gain, or power through it, and what is the benefit of that? I mean, to me, when I think of sexual activity, it's something that's pleasurable, enjoyable, orgasmic. I release oxytocin. It feels good. When you have pain with something, you don't want to perform that activity. It's like putting your hand on a hot stove and you know it's going to burn. So you don't want to keep going back and just laying your hand on that hot stove. What happens is then we tend to withdraw, we tend to avoid, we tend to shut off. And that is when we have shame, distance, and we kind of just pull back from an activity that doesn't feel good to us. And so the power through is not a positive experience for a partner if it's painful. Now, there are a variety of reasons that pain can occur. I would say the first is you need to rule out infection. If there is a bacterial infection, a yeast infection, a urinary tract infection, you want to go get cleared with a medical provider and make sure that's not the case. And if you are negative for an infection, then you can rest assured that's likely that's not the cause of your discomfort. You can have nerve pain, and nerve pain can actually occur because you have nerves in this area that can be compressed from sitting, from exercise, from muscle tension. Like if I sit for a long time at my desk and my shoulders are really hunched and I'm all stressed out, I start getting headaches. The same thing can happen in your pelvic floor muscles. Those muscles get tight and tense and they can irritate nerves, and that can cause vulvar burning, pain with insertion, pain at the vaginal opening, even pain with wiping or wearing jeans. The other thing that can contribute is scar tissue. If you've given birth vaginally, almost 90% of female bodies have a perineal tear, which is a tear into the muscle at the vaginal opening. And scar tissue isn't as elastic and soft as pre-injured tissue, so that it just feels tight. And if you're not rehabbing that scar and massaging it postpartum, that can be a trigger. Another really common thing, obviously, as a muscle specialist is muscle tension. So you have layers of muscles in your pelvic floor, and the outer layer can be tight or tense and prevent any insertion into the vaginal canal, or that deeper layer, that kind of bowl or basket of muscles, can also be in spasm or tight. And when you press on it with a penis, a dildo, a finger, it can elicit pain that feels tender or bruisey. So really, I've worked with women for, almost 2 decades, and they're coming in and they're like, I feel broken. I can't have intercourse. It's causing relationship issues. I can't get pregnant. And it's literally a muscle spasm that could be causing this. And it's just something that was never considered. A gynecologist doesn't test your muscles. A urologist doesn't test your muscles. You have to see a pelvic floor therapist to test your muscles. And so we're really able to discern, is this a muscle issue? And then guide you on how to relax those muscles to address the pain. So in the case of pain, kegels are not the answer. Strengthening is not the answer. It's typically a relaxation regimen. The last thing I want to touch on is vaginal dryness. That could be due to medications. That could be due to hormones. If you have lower estrogen levels, you're on hormonal birth control, or you're postpartum and breastfeeding, or you're perimenopausal. Low estrogen levels also cause vaginal dryness and thin vulvar tissues, which could lead to pain as well.
The kind of tense muscles, the relaxation piece that you're talking about, is that vaginismus? Is that what we're...
Yep. Vaginismus is one name for the condition. They've actually kind of renamed it. It went through a rebrand in the past 5 years, and they call it genitopelvic pain and penetration disorder. But it's because vaginismus, the Latin etiology is like spasm of the vagina. So yes, that is absolutely one of the terms that people come in with. But there's also a term called vulvodynia, which is pain in the vulvar region. So these are kind of diagnoses, but ultimately it is vaginismus or a muscle tension issue that could be causing the pain.
Before we get to the rest of the episode, I want to thank the partner of this week's content, Dossier. I have worked with Dossier for years for a reason. Dossier is the perfume house of the next generation. They make imitation fragrances of luxury high-end brands at an affordable cost without losing out on any of the quality. Every scent is crafted with the best, most high-quality ingredients from France, the perfume capital of the world, and they have over 100 luxury perfume impressions, as well as their own line of scents. For example, this is a new one I haven't tried. This is Dossier's scent Powdery Tobacco, which is an impression of Tom Ford's Tobacco Vanille. Tom Ford's perfume, and I'm talking Canadian dollars here, retails for $385. This goes for $39 US, and you can save even more if you bundle scents together or do one of their sign-up bonuses. And when I tell you that they smell the same, they smell the same. I like to play the little game, what kind of gay would wear each perfume? So let's start with Powdery Tobacco. I have not smelled this one before. Wow, this is like CEO gay, just closed a big deal and is like in the gentleman's club having a cigar. That is the scent of a powerful woman. I also got Woody Hyacinth, which is an impression of Chanel's Chance. Ooh, this is I'm a mom golfing. I'm at ladies club. I'm at ladies night golfing, and I like vodka on the rocks. This is Aromatic Star Anise, which is an impression of Dior's Sauvage. Ooh, okay, I want to say sexy man, but lesbian, okay? You know what I mean. This is like Calvin Klein model man, but lesbian. That's what Aromatic Star Anise smells like to me. And last but not least, Citrus Ginger, which is another Chanel impression. Oh, this is First Date Non-Paying. That's what this one smells like to me. Wow, those are all winners. And of course, Dossier is cruelty-free. It's vegan, which so many of the luxury perfume brands are not. So you are getting the luxury scent, the luxury quality, but without the luxury price, and also cruelty-free and vegan. There's no downside. Dossier's website, as well as all of the scents I talked about today, are linked in my description and in the show notes. Thank you again, Dossier, for partnering with Sleeping Around. If someone is listening to this and they're going, oh my God, that's me. I'm having that pain descriptions that you're giving. That is my experience. What do I do? How do I want to have penetrative sex, or I want this pain to go away. What steps can somebody actually take?
There's so many. And so, obviously an option is seeing an in-person pelvic floor therapist, which is, they're not everywhere. I know they're where you are in Vancouver. I'm here in New Orleans. So we have thousands of us across the continent. However, it's not always easy to get in. Sometimes there can be insurance barriers or cost barriers, or just, logistical challenges. So you can see an in-person therapist, you can do a virtual consult with a therapist. I know a lot of organizations have that, and we have a team of therapists who offer online consults as well. Or you can do some home programs. So, I created a platform called the V-Hive that has a painful sex program. And one of the reasons was because everything I saw out there was like kegels, strengthening, postpartum, less leakage, prolapse. And I'm like, almost 1 in two women will experience painful sex at some point in their lifetime, people need to know how to relax their pelvic floor. So I walk through different stretch routines that are similar to yoga, breathing exercises, how to change your posture, how to massage your hip muscles and your inner thigh muscles, and then also using different devices. We call them vaginal trainers or dilators, or an internal TheraWand, which help relax the internal vaginal wall muscles. But I always tell people, it takes time. You've likely experienced painful intercourse for months to years. It's not going to go away in days to weeks. But staying very consistent with a regimen, I think of it like peeling layers of an onion. Like you can kind of work on those outside layers, like your abs and your core and your hips, and then you start getting to the inside muscles. And over time, you can really develop better relaxation of these muscles to be able to tolerate insertion. So I always say, like, you kind of have to learn to walk before you try to run. And that's what this really is teaching your muscles how to relax and desensitize the tissue to insert something. And then you can jump into penetrative intercourse.
So what you're saying is that this is not a lifelong sentence.
No, it's not. Oh, no. I mean, it's a condition. Think of it like you have headaches or migraines, right? I mean, it may be something that we know your physical body tends towards tension or muscle spasm, and you have to kind of work to balance that. But it's not a life sentence. It's really so manageable. I think back to, and I told this story in my book, to one of my very first patients, my first year of practicing in Austin, Texas. And she was a young woman who had come over internationally, had just gotten married, and had never had sex. And she came in and she probably saw me for 6 months, and she didn't speak a lot of English, and her husband sat in the room with her. And we eventually got to the point where she was able to have intercourse for the first time after working together for 6 months. And she came in with her husband and she was crying. I mean, tears of joy and relief.
Yeah.
And as a new bride, she had felt like she wasn't a woman until this happened, which is not the case, but that's how she felt. And her husband was there and he hugged me, and I had never seen him pay his bill so quickly before. He was overjoyed. And then a year later, I ran into her in a grocery store and she was pregnant. And I just was like, the smile was ear to ear on my face. And I was thinking, gosh, this is the effect, the positive ripple of this work, is that it can really change people's lives. And it's not a sentence. It's really just a condition that just needs to be managed and needs to be treated. And there is, hope and joy afterwards.
That's one of the reasons I was so excited to have you on the show, to be able to say with our full chest, like, if you're experiencing pain with intercourse, and intercourse or penetrative sex is something that you want to be having, there are ways, it's not a life sentence. And we can talk all day on this show, on whatever show, about pleasure and like get to know your own body and communication and all of these wonderful things. But if at the end of the day, you're experiencing something like vaginismus, vaginal pain, that's not helpful to you.
Yeah.
And so to be able to say to those folks who are experiencing this, like, it's okay, is so powerful.
I love that. And I think you are exactly right. And it's one of the reasons that I am so vocal about these conditions is, I hear so often, like, with a postpartum mom, they're like, exercise is so important to your mental health. And I'm thinking, if you're peeing your pants, you're not going to go out and run after giving birth.
Yes.
Or, you should be, intimacy should include this, and you can have these orgasms. But behind the scenes, I mean, you maybe have never had an orgasm, or you can't even insert a tampon, let alone a penis or a dildo. You don't even know where your vaginal opening is. And I think there's just a lack of education in our healthcare system and a lack of conversation in our communities about our bodies. I mean, these are body parts like shoulders and elbows and ankles. And I really talk about them that way. And so I think when we kind of demystify what's going on with our bodies, it just gives people confidence, it gives people education, and it really empowers them to say, like, oh, this is literally just muscles, and I just need to get my muscles addressed.
Yes. When you think about it like that, it also makes the kind of stretching component make more sense and feel less uncomfortable or shameful or stigmatized, when it's like, they're just muscles. They're just muscles like any other muscle. And There's maybe a strengthening component in terms of orgasm, and there's a relaxation and stretching component to opening,
Right, exactly.
There's both sides, basically. Both pieces are important. In talking about dilators and just different experiences and different folks who might come into pelvic floor physical therapy, I have a lot of queer listeners in my audience, a lot of trans people. How can somebody know that this is a space that they can go safely? Are there questions that somebody can ask? Like I'm sure that the training that you receive is like the language of male body equals body with penis.
Right.
Female body equals body with vulva. How can these spaces make it known that they are safe for trans people?
This is a great question because I think it's not a given that it is a safe space. I think you really have to search for a medical provider that does feel friendly to whether, you're queer or trans. And so I would honestly just go to their website first. Some of us have, like on our website, we have transgender care. So knowing that myself as a pelvic floor therapist, I've gone through the training and the coursework to get the education on how to approach a patient in that space. The same thing, somebody may have the LGBTQIA flag, or I would honestly email them. I would call them. I would look at their social media. Just kind of like it's a relationship that you're diving into, an intimate relationship. And so I would do a little bit of background research and don't hesitate to reach out. I think it's much more important to do a little bit of background work and some due diligence before just going into a session. And that's a more harmful experience for you than a helpful one. So that's where I would really start. And so I wouldn't hesitate to ask questions either. So, for myself, if I'm going to go see a provider, I'm like, do you take this insurance? Do you treat this condition? Do you do internal assessments? Are you comfortable with this? I want to know those answers. And I think that you should do that as yourself. One of my biggest things in healthcare, and especially in pelvic healthcare, is that you have to be your own advocate. You have to. It's a space where we don't know a lot. It's still growing. And every pelvic healthcare therapist is not the best therapist. Just hands down, they're not. I was looking at something the other day that said 4 months from PT to pelvic health expert. And I'm like, 4 months doesn't make you an expert. And we shouldn't be saying that. I mean, you need thousands of hours to say you're an expert. You may have training, but I don't think we're doing people a service by saying we can treat something that we aren't qualified to do. You're going to do much better if you came in to see me and say I don't see male patients, which I do, but I'm not going to just take you in and be like, oh, let me see if I can try. I'm going to go, you know what? So-and-so in my community is an amazing therapist and they treat male patients. I think you're going to do really well seeing them. And that's what I would do as a provider, because I'm not going to be the right provider for everybody. The second thing is, I think when it comes, we do see trans folks in our clinic, and we see all walks, really. I've been doing this for over 17 years, and the therapists I've worked with each have been doing it for 7 to 10 years. But we'll also tell you if it's outside of the scope of what we can practice. But there are specific things that we can treat. So if you are someone who's had a top surgery or a bottom surgery specifically for a trans person, you would want to go somebody who has that expertise versus treating a trans person for something different than that surgery. I have a ton of queer patients, and it's worth looking into and worth doing some research before scheduling.
And it's such an important point for looking for any sort of healthcare. Like, I come at this from the therapy realm, right? Like, I'm training to be a therapist. And the same can be said for mental health practitioners. Anybody can put counselor on their website. It is so under-regulated. There is a level of due diligence that's needed to make sure that the person that you're going to see is qualified to work with you. So self-advocacy, I think, it's a good reminder for anybody, really.
Yeah. And qualifications. I mean, to your point, when I think back as to why I started my VHive platform, I was seeing tons of fitness professionals come out with pelvic floor program. I'm going, oh my gosh, these people had a weekend course. I have a doctorate degree and have a board certification, and no other therapist was putting out exercise programs at this time. And I said, I just don't feel like that's where I want people to go to get their education and information. So it was really kind of the thing of advocating for my own profession and saying, I really want people to have the most up-to-date evidence. I don't want it to just be the new trendy Kegel ball thing that's getting promoted. So That's,
Yep.
Part of the mission as well is to get the best evidence and the best information out there.
So let's talk a bit about kegels. What are they? Are they useful? And if so, how do we do them?
So a Kegel, it's actually an exercise named after Arnold Kegel, who was a gynecologist back in the day. It bothers me tremendously that a pelvic floor exercise was named after a male gynecologist, but that's medicine.
Hilarious.
A lot of things are.
Mm-hmm.
I said the other day I want to rename them,
What can we call them? Keeleys.
So they're contractions of your pelvic floor muscle. So we talked about this muscle sitting like a basket, and it's got the 3 openings for the urethra, the vagina, and the anal opening. And it's a contraction where you squeeze that muscle to close the sphincters and lift it up. So it's a squeeze and a lift. So one of my favorite ways to coach people is to think about sit up nice and tall. You don't want to be slouched over. You want your sit bones on the chair. Take a big, deep breath in and out to help relax all the muscles in your body. And then I want you to think about your vagina sipping up a really thick smoothie. So it's a pull up.
Oh, you can really feel it.
And you can really feel it. It's not like a butt squeeze. It's not a butt squeeze or tightening your tush. It's a drawing up. It's a sipping up with the vagina.
Oh.
And that's a Kegel contraction. So it's closing the sphincters and lifting that basket. And a way to test it is if you're urinating and you just try to stop your stream. But I want you to do that one time. I don't want people doing Kegels when they pee. Yeah. But it's a great way to test, can I close that muscle? Can I tighten that muscle? And so it's another way to test it.
What are Kegels actually useful for?
So a Kegel, just like you do a bicep curl to kind of bulk up and thicken your bicep muscle, it's the same thing for your pelvic floor muscles. A way to increase the tone and the endurance is to do Kegel contractions. And there's different types of Kegels. So we think,
okay.
I know. Now we're getting into it.
Tell me more.
We think of Kegels we're just sitting in the stoplight and we're just going to squeeze, squeeze, squeeze. But you have 2 different muscle fibers in your pelvic floor. You have sprint muscle fibers that squeeze, relax. And those turn on before a cough or a sneeze, or actually the ones that contract and relax during an orgasm. And then you have these longer endurance muscle fibers, which help you close the muscle and help you get to the bathroom in time while you have the urge to go, or turn on when you're lifting weights or running at the gym, or they're supporting your organs all throughout the day. So you want to do both types of Kegel contractions. You want to do a quick squeeze and relax and make sure that you relax between each contraction. And you want to do squeeze and hold for 5 to 10 seconds and then relax for 5 to 10 seconds. So you want to work both types of muscle fibers. And you also want to do these in different positions because you don't just sit all day. You want to work in standing. You want to work with squatting. You want to work in lying down. So you want to work in the positions that you need these muscles to engage. And we don't just sit down all day. And then you build it into exercises like Pilates or bar or weightlifting. So using those muscles when you need them. So it's kind of like a crunch. You can do a crunch, but are there other ways to tighten your core? Absolutely. And you would do those planks and push-ups and leg lifts and different ways to engage your core. That's the same thing as a Kegel. You just want to integrate it into different activities once you get the base contraction.
Mm-hmm. And then that would help with something like uncontrolled urination or...
if you have weakness, pelvic floor weakness, which is causing urinary leakage or fecal leakage, or pelvic organ prolapse, which is when your organs kind of start to drop down to the vaginal opening. It causes some heaviness or bulging. I know it's more common postpartum and in menopause.
Wow. Okay.
So it's, that hammock gets stretched out and can't support those organs. So they kind of start to drop down. So you're working on contracting that muscle to relift that hammock. So for any weakness issue, and then, if you have, less sensation in the vagina or weaker orgasms, and it's not a tension issue, if it's a weakness issue, then that's where those Kegel contractions and exercises come into play.
Well, so that was another one of the common questions I saw was I have difficulty orgasming, or when I do orgasm, it's weak. How do you know if it's a tension issue versus a muscle tone issue? And then what are some things that folks can try?
It's without seeing, you can always see a pelvic health therapist and get an evaluation. You can even try to evaluate yourself. I tell people to take a mirror and can you do a Kegel contraction and see your muscles kind of squeeze and lift? If you see no contraction, sometimes it's because there's weakness. Or sometimes the muscle's already tight. Can you push out or bear down? Do you see like a big bulge out? Sometimes it's a sign of weakness. Or if you can't move at all, that can be a sign of tension. So those are a little bit more technical, but a lot of it is also symptom-based. So, thinking about if you have pain, if you have painful sex, if you have hip pain, if you have, difficulty pooping or difficulty emptying your bladder, those are all typically tension issues. On the flip side, if you have leakage, heaviness or pressure, if you're postpartum or menopausal, I would say leakage is probably the more common one. Those are typically more weakness issues. You can have both. Like you can have leakage and tension, but I would say, I know.
So
never
fun.
gets easy. But I would say walk down one path. Start doing strengthening. If your symptoms get worse, that's not the right path for you. Then you go the relaxation and then strengthening path. So, but typically you fall into like a cluster of symptoms, and that's at least gives you a little bit of guidance of where to start a regimen.
Is there anything that people are surprised to learn that pelvic floor physical therapists treat?
Yeah, I think everything we talked about, like everything from leakage to prolapse. Other things are diastasis recti, which is an abdominal separation when you are pregnant or postpartum. Another thing is, different types of like hip pain, sacroiliac joint pain, which is like a low back issue or joint issue, pubic bone pain. It's surprising that we can treat male bodies, trans bodies, and even children. Again, I would make sure that someone's certified in treating kids, but we see a lot of pelvic floor issues pop up with kids when it comes to bedwetting or constipation. So a lot of the women I see now, they'll say, oh, I've had constipation since I was a kid, or I was a bedwetter until I was 7. So you see some of these pelvic floor issues starting early, or I can't have sex now, but I've never been able to insert a tampon. So we see some of those symptoms popping up early, and then they translate over into adulthood in different ways as well.
You've mentioned a few things about like pregnancy and childbirth and the potential for prolapse, or you mentioned scar tissue. What other sorts of things in terms of the pelvic floor? What sort of impact does pregnancy, childbirth have?
Tremendous.
Yeah. Yeah.
And then just thinking, to your last question, cesarean scars and cesarean birth recovery is another one that I think people are like, oh, I don't need to see a pelvic floor therapist. I had a C-section.
Oh.
But I'm like, pregnancy itself changes your pelvic floor. It's not even how you birth. It's just being pregnant. So one of the things that happens during pregnancy is that basket of muscles is getting stretched and lengthened as the fetus grows. So you've got, in the beginning, a baby's the size of a lemon. And then by the end, it's the size of a watermelon. So imagine a hammock holding a lemon. That's not going to change it that much. But at 40 weeks, if you're holding a watermelon, that hammock is going to be stretched out. It's going to sink down lower. It's not going to support you as well. And that's where we see pelvic floor issues starting. And the research is very clear that women who are pregnant and experiencing pelvic floor issues or even back pain or hip pain, if they're able to get treatment during pregnancy, their postpartum outcomes are better versus just waiting until after you have the baby. So during pregnancy, if you're experiencing symptoms, I would start getting treatment right away. And then postpartum as well, I really encourage every postpartum mom to see a pelvic floor therapist or just start working on their pelvic floor in like an online program, because birth itself changes your pelvic floor. If you're pushing, if you have a perineal scar, if you had a C-section, all of that changes your core and your pelvic floor. And pregnancy and childbirth are two major risk factors for developing a pelvic floor dysfunction. So we want to be proactive in addressing those as soon as possible.
Being proactive, whether you plan to be pregnant, give birth or not, is that something that like, A, what does it look like? And B, is that something anybody with a vulva or anybody with a pelvic floor, aka everybody, are there things that we should all be doing as like a preventative type measure?
Absolutely. And this is what I wrote a lot about in my book. It wasn't, my book Floor that's coming out in June 2025, I wrote, what is your normal? And how does your pelvic floor play a role in that? And kind of going back to our earlier conversations, people don't even know like how to pee properly. Like sit down, breathe, don't push, don't hover.
Or and why not push?
Because it weakens your pelvic floor over time. Like you're pushing against this hammock and it's just putting more pressure down, where you just really need to relax. the more pressure down on those muscles stretches them out over time. And then how to lift weights and to contract your pelvic floor, and how to breathe so that if you hold your breath while you're lifting weights, it puts all this pressure down, and that can lead to prolapse or hernias and things like that. So really, it's everything. And so I know, literally. And
Great.
I know, we pee and poop and exercise. And I think if we just teach people the basics of how our bodies work, it just becomes natural. It becomes just normal patterns in our lives. Everything from even inserting a tampon. I mean, one of my most watched videos on social media is how to insert a tampon, because I had so many moms come up to me recently in my community and saying, I sent that to my daughter. She's just got her period and I don't even know how to teach her how to do it. And just really understanding the anatomy of where's your vaginal opening? How should you insert the tampon? Even how to use them. There's just not a lot of education. So I think going through these basics is really the best place to start to be proactive in your pelvic floor health care.
So that's like paying attention when you're exercising in terms of engaging the pelvic floor?
Contracting your pelvic floor and exhaling. So when I'm working out, I pre-contract my pelvic floor, do that little smoothie sip up with my vag and exhale. I don't hold my breath. Sip up the smoothie and exhale. If you do my online workouts, every workout, I'm like, sip up. And they're like, Sara, that's enough. But I'm like, I kind of want to be that annoying person on your shoulder. So you're doing the right thing. With pooping, not straining, keeping your poop soft, exhaling instead of holding your breath, and then using a squatty potty or a little stool under your feet. It's another way to relax your pelvic floor muscles better. And then we went over some of the peeing tips already. So just these everyday habits that really don't take a lot of work, but can pay off in the long run.
So it's not like you're saying everybody should be doing Kegels 3 times a day.
No.
No, that's more of a treatment type.
Right. And it's a little bit like I say, it's, I think when people come and they're like, oh, this feels so daunting. But I'm like, it's like brushing your teeth and flossing every day. If you do a little bit of adjustment every day, the long-term benefits pay off. And that's really what I'm asking folks to do is, get these tips, read the book, watch the videos, go see a pelvic floor therapist, and just know where you're starting or start integrating some of these habits. And then that will pay off in the long run. And if you have a problem, address it instead of letting it go on for a prolonged period of time.
We haven't mentioned endometriosis. Is that something that a pelvic floor specialist or physical therapist could work with, or separate?
Yes, and so pelvic floor therapy will not cure endometriosis. What happens with endometriosis is there is tissue that's very similar to the endometrium, which is the lining on the inside of the uterus, that is growing and proliferating on the outside of the uterus. So it's on your colon, your ovaries, your abdominal wall. And along with your monthly cycle, when estrogen is surging at different points in your menstrual cycle, this tissue gets inflamed and irritated and can bleed, and it's extremely painful.
Yeah.
That's a kind of another common but not normal. Painful periods are not normal. If you are in high school or in your 20s or 30s and you have periods so painful that you have to miss work, you have to miss school, you're in excruciating pain, if it's affecting your function, that is not a normal period. You might have some mild cramping or discomfort. You may be bloated, you may be grumpy, but pain is information from your body. And so when I have women come in and they have pain with sex or they have painful bowel movements and they tell me their menstrual cycle history, that's a red flag for me, because I can treat the muscle issue that has happened as a result of that condition, but the disease has been untreated, and that is really what needs to be addressed. And the only way to address it successfully is through surgery. So some women go on birth control to kind of help just keep the symptoms at bay. But to really get rid of the endometriosis, you have to go through surgery to take the tissue out. So it's something that we can help support a woman with those symptoms, but it's really not until that surgery is done. Endometriosis is also one of the number one causes of infertility. And so it's unfortunate that people could be going through IVF treatments and IUI and a lot of fertility treatments, but if they haven't been diagnosed appropriately with endometriosis, if that's the cause, then they're swimming upstream, and it just makes it a really difficult condition to treat and to get pregnant. So it's really an underdiagnosed and undertreated condition.
saying that if your period is so painful that it's impacting your day-to-day function, that's not normal. Are you connecting that always to endometriosis, or is that like there could be a array of things that are causing that? Or that's new for me. If your periods are painful, that's not normal. I feel like I have grown up. We have all grown up with people talking about how horrendous periods are, the menstrual cycle is painful, and that it's totally normal to be in so much pain that you're going to throw up.
It's not normal. 1 in 10 women have endometriosis, and that's a lot. And I'll tell you, 1 in 10.
That's a lot.
That's a lot. And 1 in 10 women are not being diagnosed with endometriosis. It's interesting because people say, oh, everybody has it. I'm like, no, I don't have it. Dozens of women don't have it. Like, I have periods that make me grumpy. They make me sleepy. They make me bloated, but they don't cause pain. And there's a very different situation there when it is disabling pain. So again, it's one of those narratives that I think that we thought was normal, but it's not normal. So I think the first thing is it's really challenging to find a therapist or a physician who specializes in endometriosis. It's not going to be your typical gynecologist. There's a lot of resources online. There's a great Facebook group called Nancy's Nook. And you can say, like, who's a pelvic floor therapist or who's a surgeon in my area that treats this. But I have patients here in New Orleans that travel to New York or Atlanta to see these endometriosis specialists who I know are going to give them good outcomes in their surgery versus going locally and somebody says, oh, I got most of it, but that's not going to heal them.
And so if someone's experiencing very painful periods, it's a case of like you should go to your doctor and see what's going on kind of thing?
Yeah, I would go to your doctor, but I would also go online. I think this is where it comes, everybody can't stand Dr. Google. I'm like, I love Dr. Google. This is how people find pelvic floor therapy. They go down chat rooms or Facebook groups or blogs and they're like, this is me. I mean, if medical providers they can't know everything and they're not trained in everything. So this is another situation where you do have to be your own advocate. And so if you feel like you found a doctor who either dismissed you or just put you on birth control or said that that's normal, I would find another doctor. A lot of these surgeons do online consults for free, and they can say, yep, that sounds right, or they can order tests for you or whatever the case may be. But I would try to find somebody in your area that is a specialist. It may be a pelvic floor therapist, it may be another type of doctor who specializes to go in and have these conversations. But pain with menstruation is not a normal situation. And I stand by that.
Wow.
Yeah.
This whole conversation has been really eye-opening, but then also I feel like hopeful. Because we're saying, hey, there's all these experiences out there that people are having, pain experiences, difficulty orgasming, leakage, all the things that we've talked about that feel maybe like, oh, this is just a part of life. This is just a part of having a baby. This is just a part of having a vagina, whatever it is. And what you're saying is, no, not necessarily. Like, it's something that can be worked on and can be improved, which is exciting.
It is. I'm glad to hear that that's the case, because I feel like these conversations get heavy of like, these are all the things that can happen if you have a vagina. A lot of this is historical research just hasn't been done. I mean, we know that women were not even included in research studies, up to 40 years ago. And so, and a lot of these conditions, they're underfunded and they're under-researched. So a lot of it is we're working with the best evidence and information we have. But I also think that we have been expected to sacrifice a lot as women and vagina owners. And I don't think that our bodies should have to be one of them. And there just seems to be this like vagina tax that people have to pay. Like, oh, just pee your pants, or just have painful sex, or like, oh, you're just going to stop having sex earlier because your hormones are going to dry up your vag. And I don't think that that's fair. I'm like, I don't want to end up in diapers and I want to have good sex till the day that I die. So what can we do about that?
Yeah. And then here you are 17 years later, spreading the word. It's amazing. It's amazing. Final question for you. If there's one thing in all of your work that you wish everybody knew, what would it be?
Oh my gosh, there's so much. I really want people to know that, one, if you're experiencing an issue, you are not alone and you are not broken. These are just body parts. And this is just a body part that needs a little bit more TLC than, say, your elbow or your shoulder. But there's help for this. And so I want to give you, the encouragement to get help when you need it. I think that it's not always the right time. You might be listening to this and say like, oh, maybe I do need this, but let it simmer. The time will come. Like, we will be here when you're ready. We're not going anywhere. But I do want to encourage you that if and when you decide and you find a great clinician or you find the right online program or a great book or whatever the case may be, that the juice will be worth the squeeze, that it is it's work.
The squeeze, literally.
Yes, the juice will be worth the squeeze because it's work, but it is for your body and you deserve that. I just try to tell people so much, like, you deserve to feel good in your body. You get one body and you get one pelvic floor. And there's a lot of other shit that's going to take us out in this world. But like, do what we can to care for the one that we have.
Thank you so much for sharing your time and your true expertise with us. Where can people find you if they want more?
So thank you. We mentioned my Instagram account, which is the Vagina Whisperer on Instagram and the Vag Whisperer on TikTok. TikTok doesn't like the word vagina. And my website is thevaginawhisperer.com, where you can find all about my online workout platform for pelvic floor exercises for strengthening or relaxation. And then also where you'll find more about my book that is coming out soon and available for pre-order now.
Amazing. This will all be linked in the description. It'll be linked in the show notes if any of you want to check it out. We are now going to hop over into the Patreon Extended, and I have a couple of interesting audience questions for you. Well, thanks so much for your time. I really appreciate you coming on the show.
No, this was a pleasure. Thanks so much, Elena.
And another thank you to Dossier for partnering with me on this episode. Remember, all of the scents I talked about today, as well as Dossier's website, are linked in the description. They are in the show notes. If you haven't checked out Dossier's scents before, it's truly a hack. Like, I will never buy a name brand scent again if Dossier has an impression. There's just no point. Like, I don't need to spend almost $400 when I could spend literally a tenth of that and still feel like this when I smell it. So check out the link in my description. You won't be disappointed. Thanks for listening. You can also access all of our extended cut episodes with bonus content from every single guest over on Patreon at patreon.com/AlenaJoy. That's patreon.com/ALAYNAJoy. And be sure to follow us on Instagram at SleepingAroundPod for updates, teasers, episode discussions, and more. This episode was produced by Elena Joy and Danae Fender and edited by Corey Mosqueda. See you next time, back here on the couch.